Hi, I'm Cassidy Richards, and today I am going to be demonstrating a subcutaneous insulin injection. We're actually going to be doing 2 insulins in 1 syringe. So first, I would make sure that I have all of my supplies, which are out in front of me, and that I would check my order and make sure I know what I'm going to give, which we will go over in just a second. I would also demonstrate my 6 rights of medication: patient, right dose, right drug, right time, right documentation, and right route. So I would also do hand hygiene to wash my hands and make sure everything is clean prior to me starting my procedure. So here we go. I will need Humulin, 20 units subcutaneously before breakfast, but the patient also is going to be needing a sliding scale, and a blood glucose has already been taken for us, which is 245, and by that sliding scale we will need 10 units. So we're going to do a total of 30 units subcutaneously today. So I am going to wipe my, actually I'm going to check my vials first. Make sure the expiration date is good, and then I'm going to just roll those in my hands to make sure that it gets mixed correctly. I'm going to check for particulates, which this one is our cloudy insulin. And then this is our clear insulin. Check that date as well, and then roll that. Everything looks good with these. So our Humulin, which is going to be our cloudy today. This is our NPH. We have Humulin NPH and then Humulin R, which is our regular. So now I am going to clean off the tops of those vials with my alcohol. So when I do this, I'm going to put the air into the cloudy first without touching it, and then do my clear, and then pull up the clear, and then the cloudy. And clear always needs to go before cloudy. So I need a total of 30 units, so I'm going to pull down to 30 for my air. So I have 30 units drawn up, well, not drawn up, but air drawn up. And I'm going to do my cloudy first. And my cloudy is my regular NPH, so I'm going to need 20 units of that. So I'm going to just inject down to the 10 for that. And I'm going to watch on the side to make sure I only do 10 units of air. So there I go, I only have 10 units left. And then I'm going to do my clear, poke that in there, inject my air, flip it to 90 degrees, grab out my 10 units, get out all my air bubbles, pull it down. I have my 10 units here. I have my 10 units. And then I am going to have my nurse, my second nurse, check my regular 10 units.
Looks good.
10 units. And then I'm going to insert back into my cloudy, which is my NPH. Pull that. And you can't insert this back, so you have to be very careful to only get the 30 units, which is right where I'm at. Recap it with the scoop method, maybe. There we go. And it is tight, and get that double check with my nurse again. 30 units.
Looks good.
30 units total. So now I will take this and my orders in with my patient. So knock knock. Hi, Mr. Skip. Can I get your name and date of birth, please? He says his name and verifies his name and date of birth. I'll just double check with you, what are your allergies? He lets me know that he is allergic to Celebrex. Anything else that you can think of for allergies today? He tells me no. I'm going to put on my gloves. And then I'm gonna wipe his skin, and I'm going to start in the middle and wipe circular all the way outside, not going back over what has already been over. I am going to take and uncap my needle. I'm going to pinch his skin, and I'm gonna say, you're gonna feel a small poke, and then give the injection slowly, and then remove. Throw it in the sharps container. How are you feeling? I'm just gonna blot your skin, make sure there's no blood, and give him his call light, adjust his bed back to the original position, and then I am going to document back that I have given the 20 and 10 units of insulin, and make sure that I did all of my 6 rights correctly. And then go to the MAR and document that I have given the dose. Thank you guys.